This is One on One. As folks who know this series know, this is Mike Maron, President and CEO of Holy Name Medical Center. Mike, listen, do us a favor. Holy Name, the connection to Haiti. You've talked about it many times. People who know the series, get us up to date. Why Haiti and why Holy Name together?
Well, interesting. So Haiti's obviously had a plight for many, many years, not going away. We were always passive participants. Our medical staff would go down and we would give them supplies, pat them on the back.
About 20 years.
20 years they were going down, mostly led by Dr. Dave Butler, very prominent obstetrician, great guy. And that was the extent of our involvement. And we were kind of like everybody else, you know, passive bystanders, and just said, that's great. And then the earthquake hit in 2010, and Dr. Butler came back and said, you know, this is at a level I've never seen. We really need you to help us. And he urged me to get more involved. And that was my first trip to Haiti in March of 2010, and I got hooked like so many people do. And that led to us actually taking over and becoming the official sponsor of Hôpital Sacré-Cœur in Milo, Haiti. It's in the north.
A hospital there.
It's a hospital. It started out as a clinic. It grew to a hospital. It absolutely mushroomed during the earthquake, went from a 70-bed to 400. Has since reduced down to about 150 beds. But on any given day, it's got a census of about 120% occupancy to 150% occupancy, so there's about 200 people there.
Well, this is in January, late January of 2015. You literally, when I called you the other day, you emailed me. I don't think you texted me because I don't think you could. You emailed me and said, I'm in Haiti.
Right.
Call you when I got back.
Right.
What was that trip about?
So this trip was about laying out our priorities and our plans with the Dr. Preville, who is the physician who runs the hospital for us in Haiti, for 2015. A number of initiatives underway, very tight budget. What are our priorities? Where are we going to go? And the problem that we're having now is we've had success, and that success is spreading, and so the demand for Hôpital Sacré-Cœur has grown. I've never seen it as busy as I did on this recent trip last week. It is just...
Demand for what?
All sorts of basic health care, clinics, preventative care, stuff here that we take for granted day in and day out that we have access to just does not exist in Haiti. And so when U.S. physicians go down and work side by side with the Haitian physicians and elevate their level of training, that word spreads very quickly. So take your pick from diabetes, HIV, AIDS, cholera, orthopedic incidents now, because as certain roads get paved, there are incredible motor vehicle accidents occurring every day in Haiti, mostly on motorcycles because that's the means of transportation, and we have to care for them all.
We had you on with Bob Iaculo from United Water, right? Talking about water issues there.
Right.
Update us.
So United Water has been a great partner. I cannot say enough about them in trying to purify and provide clean water. It doesn't exist in Haiti. Again, we turn on our faucets, we're happy, we take it for granted. Not the case there. And so together, Holy Name, Sacré-Cœur, and United Water got together and created these automated chlorinating systems, so in helping us dig wells, deeper wells, better capped wells, so we could get clean water, treat the water, get all the contagions out, and provide fresh water to not just the people in the hospital, but the community at large.
Do you ever get, I mean, I remember the first time you started talking to me about this, Mike, a long time ago. I often wondered about this, and I haven't asked you on the air, so sorry, I'm going to do it now.
No, go ahead.
With the success you've had, with the impact you've had, and the demand getting greater, do you ever say to yourself, why do we do this? Because now the expectations are greater.
Yes. Yes, I do.
Even though I know you would never have changed what you did.
No, absolutely, and no regrets. But there are times, because it can be a frustrating environment. Moves a lot slower. You take, 2 steps forward, 1 step back.
Alone.
You cannot do it all alone. You need good partners. And there are times where I question it. But there are also times, and when those moments hit, and they're rare, I sit back and I say, but if we didn't,
what would have happened?
Who would have?
Who would have?
No, probably nobody.
And then tell folks what would have happened to the people of that part of Haiti.
So this is a community of a couple 100,000 people. The hospital is the sole economic engine, plus the sole healthcare provider. Tens of thousands of people would have died. Unquestionably, without a doubt, tens of thousands would be dead. And that community would be devastated. And so for us, for the small commitment that we make, It costs us all in from Holy Name today anywhere between $700,000 and $1 million a year. It is well worth it. The return for those lives is I hope to get others to help support it, and we do that through the Crudem Foundation.
Tell everyone what the foundation is.
It is Crudem, CRUDEM.org. That is our Haitian foundation. It's a U.S.-based foundation to raise money specifically for Sacré-Cœur.
By the way, when people go on your website, does it hook up there?
It does.
Go ahead. Go on the website. It'll hook up to the foundation. A nonprofit, I just want to be clear, we're public broadcasting. It is a nonprofit. Go ahead.
Nonprofit. And the only one in Haiti, because there's so many funds have been diverted and unaccounted for in Haiti, and we're very much aware of that. So we pledge 100 cents on every dollar, goes directly to Sacré-Cœur with full accountability. I can tell you exactly where and how it was spent. Holy Name will fund all the administrative expenses and not ask for donors to support that. That's our goal.
Before I let you out of here, Mike, what has this done for you and to you in all the years you've been doing this?
It has changed me deeply. Right? There is no doubt you have a renewed appreciation for every day that we live, the way we live, the things that we take for granted that these people do not have. But it also has taught me that despite all of that, and this is the hook that gets people when they go to Haiti, the harshest, most impoverished area I've ever seen in my life, yet there is a will to live, a palpable, strong, positive spirit that permeates that entire community. And when you realize that just adding to that a little bit goes, when done properly, goes so far, and the impact it has, you cannot help but be changed for the rest of your life. And in our business, when we come back here, when my physicians, our nurses, our radiology techs, our facility guys come back here, they are 10 times better at what they do here as a result of that experience.
And we are better for covering this story and being friends with you and having you come back every time and share with us. Thank you, Mike.
Thank you, Steve.
Appreciate it.
Thanks for
Keep
having me.
doing it.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Fidelco Group, Fedway Associates, United Water, Cone Resnick, New Jersey Institute of Technology, United Airlines, and by Horizon Blue Cross Blue Shield of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.